and welcome back to this episode of This Healthy Life podcast. I'm so excited for my guest today. I have Dr. Lindsey Wells, and she is a naturopathic physician based in Connecticut, and she focuses on pediatric care for PANS, PANDAS, and autism spectrum disorder. And this is such an important topic. I haven't had anyone on the podcast talking about this, so super excited for you to be here and share your wealth of knowledge, as I know there are so many people out there dealing with this or don't know that they're dealing with this quite yet. So it's such an important topic to talk about. So welcome.
Thank you for having me.
Yeah, absolutely. So I'd love for you to start with an intro about yourself. Tell us a little bit about how you got into this space, a little bit about your practice, and just kind of a brief intro on yourself.
Great. So I'm a naturopathic physician. I am located in Connecticut. And as you said, I focus my practice on children with complex medical conditions. So PANS, PANDAS is mainly what I see, but a lot of autism, vector-borne diseases, and mold-related illnesses. And I got into this space about 10 years ago. I don't really have as much of a personal story as many people have about maybe their child being affected. It just kind of, my life led on this path. And I really enjoyed working with children and adolescents with autism. And then it kind of morphed into PANS, PANDAS. And I feel so blessed because I work with the best families that there are. And the mothers and the fathers, but mainly the mothers, they teach me every day how to be like a really great parent. And so I learn just as much from them as they, maybe they learn from me. And it's been wonderful. So that's my main practice. And I do a lot of one-to-ones, but I have some other projects that I work on. Like I have a membership group for mothers of children with complex medical conditions. I have some courses on PANS, PANDAS, and I run some free summits, just spreading information and knowledge to educate families and to help make them feel like they're not alone in this, essentially.
Mm-hmm. Absolutely. Awesome. So, we're using the word PANS and PANDAS, and there's probably a lot of people out there that have no idea what we're talking about. So I'd love for you to kind of give a brief overview of exactly what is PANS, what is PANDAS, how are they similar, how are they different, and kind of just start there at the basics.
No problem. So PANS stands for Pediatric Acute Neuropsychiatric Syndrome. So essentially what this is where there's a child that has some sort of infection, and within a period of time, they may present overnight with changes in their symptoms or personality. So the most common thing is like parents, that's a red flag where they'll be like, my child is a different child. Like on this date, they were different. And so PANS is a more broad spectrum umbrella term than PANDAS. So under that could fall strep, it could fall mycoplasma, other bacteria, viruses, whether that's the flu, COVID, common cold, it could be environmental factors. And then you hear PANDAS, which is very similar, but it's pediatric autoimmune neuropsychiatric disorder associated with streptococcus. So that is just associated with strep. So a child will, again, have this overnight change in their personality or symptoms, and it's due to just a strep infection. When PANS, like I said, is more umbrella, that it could be multiple infections, including strep, but something else on top of it, or some environmental or metabolic factors.
Okay. And then how does this differ from, say, autism spectrum disorder? Is there a lot of overlap? Is there, patients that have PANS and PANDAS also dealing with autism, or is PANS and PANDAS potentially a root cause for autism spectrum disorder? What are you finding in your practice with that?
Well, that's such a great question. So with
autism, I know.
Yes, absolutely. So there can definitely be some overlap. The biggest difference that you see is that autism is usually a gradual progression, and you usually see it very early on, right? And so a lot of times it's most commonly diagnosed between 18 to 24 months, right? And so you see this gradual developmental delay. PANS and PANDAS is an acute, abrupt onset. And so this can happen anytime during their during the pediatric time, essentially. And so you don't always see it so young. Doesn't mean it can't happen, but usually it happens a little bit later, we see more commonly, but there can be overlap. So a child with autism absolutely can have PANDAS as well. And that could potentially be a root cause, especially if they were developing, somewhat meeting all of their milestones, more neurotypical. And then in the history, there is some sort of an infection or an event that occurs that you see that abrupt acute onset. And then it's also possible that a child can have PANDAS and they start to present with symptoms that look similar to autism. And so that could be cognitive decline, that could be behavioral regression, that could be academic challenges, right? We mainly see that in with math and reading in particular. And so they might get a diagnosis of autism, but in reality, it's still PANDAS. And when you address PANDAS, those autism symptoms that you were seeing improve. Or what's very common is these families will see that their child goes through flares, which is a period of waxing and waning of the symptoms, right? So there might be a period of time where the child might have symptoms similar to autism, and then other periods of time where they're back to baseline. And it can be very confusing for the picture.
Absolutely. So that's interesting that you said it's basically kind of like, underlying infection that kind of triggers it and the child changes overnight, which is just crazy. What age group does that generally happen in? You said mostly pediatrics. Can this also happen once you're older or a teenager or young adult, or is it mostly just affecting children?
So it's technically a pediatric illness, right? So we do think that it occurs, in the pediatric timeframe. However, we are seeing it, and there has been case reports in the adult population as well. So it really can happen at any time. It's just more commonly in pediatrics. So I would say anytime, for females under 21 and males under 24, because that's when the blood-brain barrier closes. And so they're still susceptible at that time. Usually you'd see it sooner than that, of course, but there are, like I said, case study reports of adults where they are experiencing something very similar, but technically it can't be called PANS or PANDAS because it's not pediatric.
Absolutely. Okay, great. And then so you've talked a little bit about some of the underlying infections, whether that could be like a cold, even flu, strep, and what other kind of common infections are you seeing as underlying conditions that are triggering PANS and PANDAS in children?
Yes. So the most common one I'd say, and most well-known, is strep, right? That's the most common one. Mycoplasma is the second most common one. So this is an atypical bacteria that presents with almost like walking pneumonia, where somebody's coughing for a period of time, but they're totally functional. And that goes around usually in the fall and the winter time. Any type of virus. So COVID was a big one. There's a lot going on right now in the news actually about flu causing neurological symptoms. And so what that is really presenting with is some PANS-like symptoms. And other ones, there can be other types of bacteria, just general viruses, parasites, some people, mold I do put in, and yeast I put in, and as well as tick-borne diseases, which is like Lyme disease, Babesia, Bartonella. However, those technically aren't in the diagnostic criteria just because of, I think, some more because of political issues of PANS and PANDAS still being a little bit controversial, even though the the American Academy of Pediatrics did come out and validate the diagnosis just recently, which was a huge win. But we've known this. We've had over 20 plus years of documentation and research on this. And then, there's still some controversy with tick-borne diseases or vector-borne diseases. And so it was originally included in the diagnostic criteria in 2012, but they removed it for those reasons. And so I believe it should still be under it, and I treat it that way.
Absolutely. And then, so are there certain predispositions that you're going to have if you're going to be a child that's prone to it? Because I feel like, everyone's going to get a cold in their life. Everyone's going to get the flu. We're all going to get COVID at some point, and we're all going to get strep if we haven't had it already, right? So what triggers it in some individuals and not others? Is it a genetic component? Is it that they already have exposure to some of these other maybe underlying conditions that it just kind of spills over on their immune system? Or what are you finding is like the trigger in certain individuals and others that get these infections and are fine?
Yeah. So it's complicated and it really depends on the individual. But what we see is that one of the most common like relations that we see is having a first degree relative with autoimmune disease. So that will predispose a child, say if mother or father has autoimmune disease or maybe a sibling of some sort. So that by far can be a contributing factor. Second is, I do believe that tick-borne disease is at the root of a lot of this, that just makes the immune system more susceptible. Like the burden on the immune system is already high. And so it's not that our children have immunodeficiency, meaning that their immune system is not working well. I actually believe that the immune system is highly functioning, but it's working overtime, creating a lot of inflammation in the body unnecessarily. And so when these other infections come in that are the common cold, COVID, flu, strep, things that we get as children, it just kind of puts it over the edge, causing more inflammation that causes systemic, but also brain inflammation relating to the neuropsych symptoms that we see, or other environmental factors like mold or stress on the system. So whether that's perceived stress, through childhood, or it could be even more physiological stress and toxic burden. And we do know that there's some genetic predisposition as well, but my feelings are that just because somebody has the genetics doesn't mean they're going to manifest with the condition. It really comes down to the amount of environmental factors that are, placed on that individual that then leads to the manifestation of the symptoms.
Absolutely. And then, so what are some of the symptoms? So you talked a little bit about kind of it being like mostly like neuropsychiatric symptoms, but if someone's like, hey, my kid changed overnight, like what other sorts of symptoms are they going to be looking for that kind of lead you down this path of like, hey, this might be PANS or PANDAS that you're dealing with?
Right. And so, as I said, it was like an acute, abrupt onset. And so the most common thing that we see is OCD in particular, and it can be on a spectrum of OCD, right? And like with the most extreme being food restriction and like an eating disorder and anorexia. But in reality, it's just OCD about maybe contamination or fear of swallowing or textures. A lot of separation anxiety that we see, or just anxiety in general, that can be very off-putting. So a lot of times these are kids that used to love to go to school and all of a sudden you can't get them into the building, and it seems like overnight and you're not quite sure what happened. There can be behavioral regressions. And so you can have a child that all of a sudden starts baby talking or playing with toys that were years ago or watching shows that were years ago. There can be academic decline. And so if mainly in math and reading, but it can happen across the board. We see enuresis, which is just wetting of the bed. And so this could be a child who was previously dry at night, all of a sudden having accidents in their bed at night. And that really, you have to rule out PANS or PANDAS for that one. That's a pretty big red flag there. Ticks are another one. So this could be ticks that your child didn't have ticks. All of a sudden they're ticking. And what you do see is this, again, waxing and waning presentation of ticks. So childhood tick disorder, what we see is ticks can change. There might be like an eye tick or, a throat clearing tick, and that might change to something else throughout the course of their, pediatric or adolescent time. But with PANS and PANDAS, what you see is they'll have ticks for a period of time and they won't have any ticks. And then ticks again. And it's like, that really should be making you think about PANS or PANDAS. There can be rage and irritability. There can be hallucinations. And the list kind of goes on, but it's mainly neuropsych, because what's happening is there's inflammation in the brain that's contributing to that, particularly at the basal ganglia, which is the area of our brain that controls motor movement, and also some of our emotions as well. But that's why you see the tics as well with the inflammation there.
Okay. And then, so what sorts of treatments if people figure out that, hey, I am dealing with PANDAS, or you suspect it? What sort of treatments work? Is it really just about kind of finding what the underlying kind of infection or root cause of it is? Or is there something that you can do specifically for PANS to kind of help that inflammation in the brain and get that down while you're trying to uncover what might be the root cause for it?
So the treatment for PANS PANDAS, in order to have successful treatment, is the three-pronged approach. And so what that is you address the symptoms, right? Because you need to get relief for the child and you need to get relief for the family. The other one is immunomodulatory or antioxidants. And so this is really working on the immune system and decreasing inflammation there. And then the next one is antimicrobials, and that's where you address the infections. It is important to understand what the root cause is if you can, at least get an idea. You might not know everything, but at least it helps you to determine what the right antimicrobial might be, right? Because the most common, I guess, a treatment approach is going to be using SSRIs for the symptom support. It's going to be using for the anti-inflammatory or immunomodulatory support, either like ibuprofen, which is a big one that is used, or say steroids of some sort, or IVIG, which is intravenous immunoglobulins. And then for the antimicrobials are going to be antibiotics. But the thing is, you kind of have to have an idea of what germ you're dealing with in order to find the correct antibiotic. Now, there are many ways to approach this in a more natural way of it, and that's really what I specialize in. And so, I love the use of antimicrobial herbals because they do have more coverage over different germs. You can use herbs that will cover bacteria, viruses, yeast, tick-borne disease, and you can kind of hit everything at once. And then also same thing with using natural interventions for inflammation that might not be so difficult on the system or immunosuppressive. And then, of course, some people really prefer to use natural interventions to help with the symptoms, because this isn't a mental health issue. This is an immune dysregulation issue. This is an inflammatory issue. It's not mental health. So putting in, SSRIs, what we see is that maybe they can be helpful, but about 50% of our kids actually can have a worsening in symptoms or can have side effects from it. Again, just because it's not really addressing the underlying cause,
it's not dealing with the inflammation and the immune system that's overreacting.
Absolutely.
Yeah.
And so, one thing about that families often come across is that they're told, like, your child just has anxiety. This is a mental health issue. They need to see a therapist. When, yes, a therapy can be extremely beneficial, specifically cognitive behavioral therapy, but you can't just rely on using an SSRI or an antipsychotic. And you definitely, with these kids who are sensitive, the answer isn't always to continue to increase up the dosage of those if you're not getting a response. It may be to try something else, or to really, again, look at the underlying cause as to why this child all of a sudden has anxiety or OCD. People don't just wake up where that happens overnight.
Yeah, absolutely. Absolutely. And I'm sure like most patients are going to like their regular doctors. Like you said, they're going to be like, oh, here's some anti-anxiety medicine or an SSRI and do therapy. And you're not really going to get to that root cause of like what is causing all these issues that just showed up overnight, which is clearly not normal. So yeah, frustrating for sure.
Yes. And it's really important for parents to go back in the history of like before their child started to present, like, was there an illness? Or was the child exposed to an illness? So it doesn't mean that they had to present with the acute symptoms of a fever or lethargy or, congestion, because their body could have just responded by increasing the inflammation, causing neuropsych symptoms. So you usually want to look back in the history by like 6 to 8 weeks. Was there any type of exposure at that point? And it can be challenging to communicate that maybe fully in a brief doctor's visit, but I just always encourage parents to listen to their gut. When something is not right with your child, and go with that. And then also just look back and just see, is there something that could have been a trigger for my child?
So it's about 6 to 8 weeks after the infection that this generally happens, or does it ever happen more quickly that say, hey, they just got COVID and then a week later their personality is completely different? Yes. Can it happen that quickly, or is it more of a delayed onset?
It absolutely can happen more quickly as well, but it can also happen up to 8 weeks later. And some people, it can possibly be even further than that, but that makes it challenging, right? Because that's like 2 months maybe
Yeah, trying to
after.
remember what I can barely remember what I did last week, and that's just for me. Trying to remember what someone else in my family did is going to be even harder, right? So yeah, just kind of really
Exactly.
keeping track of that, I guess,
Yes.
and just being mindful, keeping track of your calendar, I guess,
Yes, absolutely.
taking lots of notes. And so, what sort of testing do you do, or can you do if you do suspect PANDAS? So, are you going to be looking for kind of that toxic burden and underlying infections, or is there other testing that you can do for inflammatory markers, or the brain and things like that that can kind of point you in the direction, or is it more of a clinical diagnosis based on the history and based on the symptoms?
So PANS and PANDAS is absolutely a clinical diagnosis. So there's no test that rules it in and there's no test that rules it out. It's really based on that medical history and the history that we just discussed on top of physical exam, because physical exam can give you a lot of clues potentially of what germ you're dealing with. But of course, there's testing that I find to be helpful to help determine potentially what other germs could be there, right? So you would, run strep antibodies, but you can have elevated antibodies and that doesn't mean you have PANDAS, or you could not have antibodies and doesn't mean you don't have PANDAS. So it's a little, you have to have somebody that's really well versed in this world to be able to even interpret the labs correctly. Because I get some people that come in with elevated strep markers, antibodies, and they said that their practitioner said they had PANDAS. That's not true. But I'll run mycoplasma markers. I will look for yeast markers, tick-borne disease markers, inflammatory markers, and ANA is the most commonly elevated marker. And so that's anti-nuclear antibodies, and that is a screen for autoimmune disease. But in reality, we run it just as a non-specific marker for inflammation. So that's the one that is most commonly positive, actually. Looking at liver and kidney function, blood cell counts, and nutrient levels. And then depending on the individual, if more like specialty testing is needed, again, for toxic burden, other mineral levels if needed, looking at their gut. So.
Okay. And then speaking of gut, I was going to say, is that kind of a big important piece of it too? Like, I'm sure, if you're having all these kind of issues with your immune system and inflammation, your gut probably needs some support and diet as well. So what sort of recommendations do you make around, like, say, gut health and diet? It can probably be challenging getting kids to eat certain things or taking things away, but what's kind of a good supportive diet that kids can be eating if they are dealing with PANS and PANDAS?
So the biggest thing is just assessing the case to make sure the child doesn't have any food restriction, because that makes it very challenging to take more out of their diet, because it is a real concern in this population. But, just taking out big inflammatory food groups. So dairy, as well as gluten is, a lot of people find benefit from that, especially if they have an elevated ANA. Taking out gluten can be helpful for that group of children with PANS and PANDAS. And then the groups that have the cerebral folate deficiency, taking out dairy can be helpful. Looking at the gut just to see, is there like other bacteria in the gut, parasites, which is hard to find on stool tests, but we look for it. Clostridia can be one of the germs as well, and yeast overgrowth. And so yeast is pretty common actually in this population, because how they conventionally are treated are with antibiotics and long-term prophylactic antibiotics. And so yes, that is very helpful, but we are creating another issue here by having these children have a lot of yeast overgrowth, and then that causes a host of problems as well that we need to address.
Yeah, that's a whole other
Yes.
beast, right?
Yes.
And so are the symptoms for PANS and PANDAS, are they pretty constant? Like every day you're just kind of like dealing with the same symptoms, or do you have like good days and bad days and flares? And how do you kind of manage the symptoms while you're working with the kids?
Yeah, so the flares, they wax and wane. And so usually what you do see is periods of time that things are hard, and then periods of time where things are better, like more back to baseline. And that can last anywhere from weeks to months. Hopefully it's not lasting months that you're in a flare. But I always tell families, if you are dealing with these symptoms every day, at some capacity. Sure, some days are going to be better than others, but you're still dealing with it every single day. You really need to look for 3 different things, because I call that like a constant flare, which is tick-borne disease, mold disease, or yeast overgrowth. And usually it's at least one of those.
I was going to say it's usually probably a combination of all of it, right?
Yes. Yes, but
Just
you
in
definitely
different degrees.
absolutely. So you should see those waxing and waning periods, but when you don't, that is a light bulb. Okay, I got to look a little bit further for one of those other three things.
Okay. And then I want to go back to something you mentioned that I want to pick your brain about. So you mentioned that depending on what the symptoms are, it kind of gives you insight as to like what the underlying infection is or the bug is that kind of like tipped them over the edge, right? So can you share a little bit about what you're seeing in that and what correlation there is between symptoms and certain infections?
Yeah, absolutely. So with ticks, in particular ticks, like if a child has a sniffling tick or moving their nose tick or a throat clearing tick of some sort, I feel like the facial ticks kind of give us a clue on where the germ might be harbored, right? So if a child has a throat clearing tick or something going on in their mouth, you need to swab in the mouth to see if the germ is there. Same thing with the nasal cavity, because the sinus cavity is actually an area where a lot of practitioners don't look for germs. And it's pretty amazing what comes from testing from that. And when you address that, how you will see, for instance, like the tick resolve or their OCD or anxiety get better. And so I always tell like practitioners that I mentor or when I lecture, like, wherever the child is ticking, that's giving us a clue. And so look at that. The other thing that I will see that's the one huge symptom that can be really impactful for the child's life in the household is rage and aggression. No child wants to be aggressive. No child wants to be angry and mean. They want to be loved and like praised for how good they are, and they want to please others. And so if your child is presenting that way, please know it's not them. There's something else going on. And that is a clue that there's likely Bartonella, which is a vector-borne disease. Like that's the most classic thing that I see in a child who has rage and aggression. Also, you'll see stretch marks on children, and they're red-ish, purplish. If you press on them and when you pull your finger off, if it blanches, so if it goes white and then it fills again to be red or purple, that's also indicative of Bartonella. So that's why physical exam is super important there. When it comes to yeast, for instance, you might see like a white tongue. We could see I guess like eczema, dandruff, that's another sign on physical exam. And a lot of difficulty with like executive functioning or challenges with, I guess I would say like academics and brain fog. I would say a lot of either tick-borne disease or mold. And what else would I, the other one for cerebral folate deficiency, I will see like there could be a potential with speech disfluency. So what that means is like a child might stutter during a flare where they don't have a stutter other times, or they might put in some extra words like or ahs, or they might baby talk, or they might go have like selective mutism actually. That then gives me a clue like maybe cerebral folate deficiency is going on here.
Okay. So a lot of different things depending on how it's presenting. And I'm sure there's probably like an overlap of things too, right? I mean, like
Absolutely.
usually like if you have Bartonella, you probably have Lyme and other tick-borne infections and more likely going to be more sensitive to mold. So it all just ends up being this giant pot of things that you have to kind of get yourself out of. So yeah, well, it's
and
pretty
I always tell parents, like when we go through, like after we do testing and then the first follow-up when we're going through everything, it can be so overwhelming. But I always tell parents it's such a good thing to find things because that means we can address them.
Yeah,
absolutely.
Exactly.
And so there's hope. Things are going to get better.
Yep.
The worst part of my job is when you do all the testing and it's still like a very unclear picture. And it's like, okay, we're just going to go based off of symptoms. That doesn't always feel so good for, the family and the child who are really suffering. But finding things is a good thing because that means
gives you something to work on.
Yes, we can make a difference.
Absolutely. And then, so let's talk a little bit about the families. Like, I mean, obviously this is going to be a horrible experience for the kids living like this, and especially like, being kind of shifted in their bodies overnight. But I'm sure this is incredibly challenging for the parents as well. Like managing their care, keeping up with kids is already so difficult, and then just seeing that happen to your child overnight. So what sort of support do you have or offer or recommend for parents out there that are dealing with a child with PANS and PANDAS? Because I imagine it's a long road of recovery, right? I mean, at least
Yes.
probably 2-3 years to get back to more or less normal. I mean, there should be improvement along the way, but those are a lot of long-term conditions to kind of heal from. So
Right. So PANS and PANDAS in general, it really, there's 2 points of resolution. It's either at puberty time, and that usually what happens if a child gets it very early on. And then if they get it later, usually it will resolve by when the blood-brain barrier closes. So 21 or 24.
So it does resolve itself eventually if you don't treat it. Okay.
A child will have might still have some anxiety or OCD, like little things that they might be prone to, whether they had PANS or PANDAS or not, that you might see that after adulthood, but their life will be significantly better. And it's, just a little bit of, encouragement. And I get for families is the children who are now adults that I have, they're so resilient. Like, they are amazing. They can go through life and they can tackle things that might be challenging, like getting a new job or getting fired for the first time or a breakup or being away from home. They have so much resilience. And I always ask them, like, how do you do this with such ease? And they say, this is nothing compared to what I went through as a child. And so if you're in the thick of it, just know, like, it's not fair, but your child is going to be a really resilient child and adult. And there's like some gifts that come out of this as well. So when it comes to the family, it's very hard because seeing your child suffer and feeling pretty helpless and it having this waxing and waning presentation is very traumatic, not just for the child, but really for the family members, right? Because it's so hard. So I guess it's just validating your feelings, being gentle with yourself. And one thing I can't stress enough is that making sure you're still prioritizing you as the parent and your health and your mental health, because when you feel better, the child will feel better without us doing anything, whether that's implementing more support or whatnot. It's like our kids still feed off of us. And it is really true that there is like PTSD associated with this. So every time a child flares, I really see that it's more of the parents that are going back to the beginning of like that panic state more so than the child. Of course, it's very hard for the child, but it's very real for the parents. Like, are we going to be able to get out of this again? Like, how long is this going to take? How bad is this going to get? And it's real. There's now studies done, like research on the caregiver burden of parents who have a child with PANS and PANDAS. And, it was pretty remarkable that they were comparing it to caregivers of somebody with dementia or caregivers with a child with Rett syndrome. Like, this is real. So I guess all I can say is, like, I see you and I validate you. But you got to also prioritize yourself just
put your
as
own
much
mask
as you would.
first, right?
100%.
First, yeah.
And it's so easy to say that and very hard to do.
Yeah,
and
absolutely.
So,
especially when it's like your child that's going through this and you can just be so inundated with everything that they're dealing with and kind of just get yourself in this flight or fight response,
yes.
right? And that's like the last thing that your child needs is to have you in that state. Like, they need you to really be there for them. So you have a group, you have Well-Minded Mommas Club that you put together. Can you share a little bit about that to kind of help support parents that are going through this?
Yeah, so it's a membership for mothers who have children with complex medical conditions. So a lot of the moms have children with PANS and PANDAS. Some have autism, their children have autism. Other ones have mold disease or vector-borne diseases, but it's a really supportive community. We meet twice a month virtually and for a community meeting. And then there's weekly mindsets just to help, our own mental health there. And then some quarterly intensive where the moms vote on what topic they'd like to learn more about. But the biggest thing that I just heard is from my moms is that they felt really alone during this process. They couldn't really talk to their friends or their families about it because people just didn't understand. Like, if you don't live it, you don't understand how difficult, challenging, traumatic this can be. And they just felt really lonely. And it was so interesting because I'm like, I have hundreds of moms who are like the best moms ever who get it. You don't have to say anything. You don't have to explain yourself. They get it. If I could get all of them together, what a difference that would make. So it's a small group right now, but it's a beautiful group. And I really enjoy my time with these moms, and they enjoy the time with each other. And I just think a nice little thing for mothers to do to like support themselves and take care of themselves. And it's just a little bit of a time, like small amounts of time during the week. The mindsets can range anywhere from a minute to 4 minutes. We have some time to listen to that once a week, and then 2 hours a month. So it's, just giving ourselves that time is important.
Absolutely. That's awesome. And then, so you also have a book, and you also have a online course as well, right?
Yes.
So I'd love for you to share a little bit about that for our audience in case that's something that can be helpful for them as well.
Yeah, so I have a book. It's called Super Sam and the Battle Against PANDAS, because with my mission of supporting families, I also noticed that the siblings who have a brother or sister with PANDAS, it can be really hard for them because a lot of the attention can go on that sibling that's struggling. It can be confusing because of the up and down nature of the illness. And so it was just a way to communicate with those siblings of like the nature of how this illness is, what is happening inside of their loved one's body. And just even though things might look a little different for their family is still super and strong and beautiful. And I wrote it just to be like very encouraging, but also to speak to the sibling that, like, again, we see you and you matter too. But a lot of people have, given me some feedback that it's been helpful to even explain to the child who's going through the condition of like what's going on inside of their body, or they read it to the class, so their classmates and their peers can understand what their child is going through, or their teacher. And so I'm very proud of that little resource I put together. And then I have a course, it's called PANDAS Power. And so it is a course that is mainly for families that need support now, because what the challenge can be is that you figure out this is what your child has, and then you want to go to a specialist, but the specialist has wait lists that are months and months long, and you're like, I need help right now. And that was the purpose of this course. And so I break it down to explain what PANDAS is, how to manage the flares. I break it down into the 3-pronged approach of what to do with antimicrobials, immunomodulatories, and symptom support. And there's a lot of resources in there as well for just getting more support, or dosing, certain like general dosing guidelines. And it was my way again of like, how can I help people out who really need help right now while they're waiting maybe to get into meet with a practitioner that can kind of lead the care. And I always tell my moms, like, your job is to be the mom, not to be their healthcare provider as well. But at least this is a starting point to do something
while you're waiting.
Because it can feel completely helpless.
Yeah, especially with like, it can sometimes take 2, 3, 4 months to even get in to see a practitioner that you want to see. So you kind of have an idea this is going on, but you're just kind of waiting, but you want to do something and see if it can help in that meantime. So that's super helpful.
Absolutely. Yes.
Yeah. Awesome. So I want to end with one last question. So, it sounds like you've done amazing things and worked with so many kids and families in your practice. What's like one amazing success story that kind of sticks out that you've had in your practice? I'm sure there's numerous ones, but one that you can share with the audience that kind of really, really made you feel good about being able to help that family and child.
Yeah. So I have one, he's an adult now, but he was my inspiration to do more research on cerebral folate deficiency. But he was somebody that came in with a long history of PANS, had done so many things, IVIG, plasmapheresis, antibiotics, up the wazoo for years and years. So incredibly sensitive, wasn't able to tolerate many things. And so we started just simply with dietary changes and adding in folinic acid, and his OCD and anxiety significantly resolved. And then we were able to slowly bring in herbals to address the underlying causes. And he's gone to college. He has amazing and internships, got a very successful job coming out. And so this isn't a forever type of thing. And throughout treatment, you don't have to wait till those 2 times resolve, which is puberty or adulthood. You're just really looking for the flares to decrease in severity, frequency, and duration. And like I said, they're so resilient, and these children are incredibly intelligent, and they are going to be successful, like in the end. And there's nothing better than to see them thrive and like become independent individuals who are doing great. So,
oh, that's awesome. Yeah, I'm sure it's so great to see, like, once they kind of get older and get their lives back and start doing some amazing things out in the world.
yes.
So it's awesome that most of them are doing well now. So
Yep.
thank you so much, Dr. Lindsay Wells. If people want to find you online, what's the best place to find you on Instagram and your website?
So my Instagram handle is Lindsay Wells ND, and then my website is www.lindsaywellsnd.com.
Perfect. And we'll link to everything in the show notes as well. So thank you so much for all this information. It's going to be super helpful for our audience.
Thank you.
Yeah.